Today I'm going to be presenting and talking through a working paper on community social capital and post-disaster mental health that I'm working on in collaboration with my friend and colleague Kevin Smiley, who is a faculty member in the sociology department at Louisiana State University in Baton Rouge. So the motivating question behind our paper is to begin to understand how community or neighborhood level social capital shapes post-disaster health outcomes. Now, addressing a question of this size is best done in motivation for one's entire career, not in one particular paper. So we're going to take a chunk out of this broad motivating question and focus specifically on the effect of neighborhood social capital and population mental health using the case of Hurricane Harvey, which occurred in Houston, Texas in August of 2017. So to introduce you to the case that I'm going to be talking about today, Hurricane Harvey occurred late in August 2017 in Houston, Texas, which at the time was the 4th largest city in the United States. It's now the 5th largest city after Dallas-Fort Worth. But what made Harvey so devastating was the fact that the tropical storm stalled and dumped nearly 40 inches of rain in less than 24 hours, which was unprecedented level of precipitation for a tropical storm of its size. The image on the right is showing you an aerial view of some of the flooding in the West Chase neighborhood west of downtown in Houston. And the map on the left from the New York Times shows just how, given the unprecedented amount of rain, flooding occurred across the region in areas outside of traditional flood zones. So estimates suggest that human activity made Harvey 1/3 more precipitous, and consequently, Harvey became one of the costliest weather-related disasters in American history, killing around 100 people and causing $125 billion in damage, US dollars. A recent assessment by 11 climate scientists concluded that there is a detectable long-term increase in the occurrence of Harvey-like extreme precipitation events in the Texas region, and that anthropogenic forcing or human activity has contributed to an increase in the frequency of participation events like Hurricane Harvey. So as such, we can think about Hurricane Harvey as a harbinger of tropical storms in the region to come. So using the case of Harvey, we're going to ask two research questions, which the first is, how did the mental health effects of disaster-caused home damage due to flooding, our measure of disaster exposure, vary across neighborhood-level forms of social capital? And given that assistance from other people in your neighborhood is a key instrument through which we expect neighborhood-level social capital to shape well-being, we're also going to ask how the receipt of post-disaster assistance from others varied across levels of social capital and home damage. So in this paper, we're interested in community-level social capital. How are we understanding it? We draw upon an understanding of social capital as the actual or potential resources linked to our social networks, participating in social groups, and the processes of institutionalization and recognition that come along with embeddedness in social groups. So whereas economic capital is something that exists in a bank account, human capital is something that exists in our brain, social capital is something that exists in our social networks. And they adhere in the structure of our social relationships. So individuals possess social capital through our connections with other people, and while social capital was originally conceptualized as an individual good, something that an individual can use, it's increasingly understood as a public good as well, as something that collectives like neighborhoods vary in the amount to which their residents have social capital and therefore may shape well-being. And the literature on what social capital does for health has developed competing expectations for its consequences for well-being. So on the one hand, some scholars theorize the salutary benefits of social capital, that the processes of bridging ties across people and bonding individuals together foster mutual exchange of resources during times of need. On the other hand, for example, other scholars have noted that social capital can have a dark side. That is, membership into social networks can place burden and stress upon people given norms and expectations for how they're supposed to act within their given social networks, and that may actually have a deleterious effect on their well-being, particularly in times of need. And scholars of natural disasters, especially sociologists, have increasingly grown interested in incorporating measures of social capital to understand local differences in resilience and recovery. This is due in large part because disasters are these acute times in need in which the activation of resources in our social networks may be particularly salient, socially permissible, and effective for promoting our well-being. Yet in a 2017 review of the literature on disasters and social capital conducted by Michelle Meyer, she summarizes overwhelmingly mixed evidence. While some find that local forms of social capital have protective, positive benefits on post-disaster health, others find no differences in health outcomes across local levels of social capital, and still others have even documented adverse consequences inconsistent with the expectation of the dark side of social capital. We posit, however, that several empirical and theoretical limitations can hamper existing studies in the disaster literature and may explain these disparate findings. So the first is that many studies are not entirely attentive to the social selection processes that result in differences in residential environments that may correlate with health, and in differences in disaster exposure or need that may also correlate with health. So for example, residential sorting processes may mean that already healthy people tend to live in neighborhoods with higher levels of social capital, and no statistical association between social capital and post-disaster health may be solely a function of those processes. Second, conceptually measuring social capital is an extremely difficult task. So the vast majority of studies in the literature cited by Meyer et al. Use survey evidence on asking local residents in the extent to which they trust their neighbors, in the extent to which they've engaged in the past in reciprocal relationships, or even a count of the number of local civic organizations in their studies. So this means that there's lots of different ways that scholars are using or operationalizing and measuring social capital, all of which, especially those that are using survey evidence, if there's an insufficient sample per neighborhood, may result in large confidence intervals and statistically unreliable estimates. So we're going to overcome these limitations, or we're going to attempt, and you can tell me whether or not we're all close to succeeding. We're going to address these limitations to answer our research question by using novel data on two cross-sections of population representative public health survey data from Houston linked to new zip code level estimates of social capital from a publicly available data source from the Opportunity Insights group at Harvard and MIT. So we use individual level survey data from the Health of Houston survey, which is conducted by the University of Texas at Houston School of Public Health. The HHS is an annual survey conducted of a representative sample of around 5,000 adults in Houston, asking a range of questions about their health and well-being. The 2017 survey began in May and continued until it was unexpectedly interrupted by Hurricane Harvey in late August of that year. After a 5-month pause during the recovery efforts, it resumed in early 2018 and concluded in April 2018. So using these data, we construct two repeated cross-sections for the mental health of 2,508 residents interviewed just before Hurricane Harvey and 2,755 residents after Hurricane Harvey, both of which were sampled to be population representative of the Houston metropolitan area. We also know there were survey responses in their residents across the 150 zip codes or neighborhoods, which are nested within 10 urban regions that the Houston Mayor's Office sets out in order to deploy types of resources post-disaster. So for those also surveyed after Hurricane Harvey, we know their residential zip code at the time that the disaster occurred. To these data, we link information on zip code level social capital produced by the Opportunity Insights group. So using data on 72 million Facebook users in the US and 21 billion friendships between those Facebook users, Opportunity Insights developed zip code level estimates of community social capital and made the data publicly available, demonstrating in several high-profile papers, which maybe some of you are familiar with in Science and Nature, the associations between local levels of social capital and long-run economic outcomes in the United States. So we link the individual health survey data from respondents to the HHS to information on social capital and their zip code of residence at the time of Hurricane Harvey from the Opportunity Insights group. Our key variables of interest are as follows. From the HHS, we gather data on 2 measures of mental health. Our first measure is on psychological distress using the Kessler-6 score, scale, which asks a series of questions about distressful feelings over the past month, including feelings of nervousness, hopelessness, restlessness, worthlessness, and effortfulness. So responses to each question are scored from none of the time to all of the time. The summed score ranges from 0 to 24. It's been validated for screening for mental illness and mental health care utilization, with research suggesting that a score greater than 13 is indicative of moderate mental distress and is suggestive of diagnosable mental illness, although this is not a clinical diagnosis. As such, we model the probability of a score greater than 13 to measure the probability of psychological distress. For poor mental health, we model the probability of reporting greater than or equal to 14 days of poor mental health in the last 30 days. This is a commonly used question by the Centers for Disease Control in the United States that was first developed by the Behavioral Risk Factor Surveillance Survey, which has been conducted annually in the US since 1993. It's suggestive that the burden of mental health for people who experience more than 14 days per month is indicative of their clinical mental health, potential clinical mental health. And so we use 2 indicators that are simply binary variables. Did you have psychological distress using the threshold, and did you have poor mental health in terms of your mental health days? In the post-disaster sample, we also gathered data on self-reported home damage from a question that asked about the level of damage to one's primary residence due to Hurricane Harvey. We use, again, a parsimonious dummy variable coded 1 for home damage for respondents who reported any amount of damage from moderate to completely damaged homes, and 0s for those who reported no damage or just flooding in the street. We also rely on a measure of the receipt of post-disaster assistance. So post-Harvey respondents were asked a question about whether they received assistance from their neighbors, from friends and family, from churches, from civic groups, and from others. And we construct a binary variable coded 1 if you received assistance from any of these sources. From the Opportunity Insights data, we use 2 measures of local social capital. Economic connectedness refers to the rate of local Facebook users who have cross-class friendships within their zip code, as measured, again, by Facebook. This measure is related to the element of social capital of bridging bonds across different types of people that may benefit collectivities in the neighborhood. We also use a measure of civic engagement, which estimates the share of local Facebook users who are members of a civic group, like a volunteer group or a political organization or a religious type of volunteer group as well. So using these data, we're going to fit a series of 3 empirical models. So there's just 3 regression equations, and then I'll get to what I think are nice figures. So we begin by examining the average associations between social capital and mental health right before Hurricane Harvey happened, and then on average after Hurricane Harvey happened in the spring of 2018. So we're going to fit a series of simple linear probability models on the pre and post Harvey data separately. So for each individual respondent in the HHS I who lives in zip code J, which is nested in the mayor's office urban region R, we predict the probability of poor mental health or psychological distress as a function of the social capital measure, those 2 measures on connectedness and volunteering or civic engagement in their zip code, a vector of respondent level observable characteristics included in X, a parsimonious set of controls at the zip code level indicated in vector Z, which may correlate both with local social capital and with health, including the logged population size, the median household income, and the share of white residents from the decennial census. And an urban region fixed effect, which nets out broad urban forms of residential sorting that may occur across the city. So note here that any statistically significant beta 1 on the pre-Harvey sample would suggest that just before Hurricane Harvey happened, there were differences across levels of social capital and health that mean that there were sorting processes even after we adjust for all of these observable characteristics. And that would call into the question the extent to which we can reliably estimate differences post-disaster in social capital and health. We then generate simple estimates of the effect of disaster home damage on mental health by reusing the first equation solely on the post-Harvey sample. We, of course, don't know anything about home damage if you were interviewed before Hurricane Harvey, and include a dummy variable for home damage. So we fit this equation by weighting it using inverse probability of treatment weights, which account for the fact that home damage is absolutely not random across individuals. So in brief, I won't go too in the depths of the inverse probability of treatment weighting, although I'm happy to afterwards. It uses the propensity score for the probability of experiencing home damage as a function of vector x and vector z. And it weights each of the individuals by the inverse probability of experiencing the home damage. And so what this results in is balance on these observable characteristics and is more efficient than just using covariate adjustment alone. So thus, by using the treatment weights and the urban region fixed effect, our models are attempting to adjust for both selection into disaster exposure and potential selection into broader urban areas in Houston. Finally, we're going to address our primary research question by reusing this equation and interacting that dummy variable for whether or not you experienced home damage with the z-score of our two measures of local social capital. The coefficient of interest here is beta 3, which represents the difference between the effect of social capital on mental health between those with and without home damage. Because social capital is entered into the equation as a z-score, we can interpret beta 1 as the average effect of the average difference in the mental health outcome among those with home damage at mean levels of social capital, because it's a z-score. And we can recover the slope on those who experienced home damage by subtracting beta 3 from beta 2. But I'm actually not going to show you any regression tables from this. I'm just going to show you some figures. And then finally, on the post-Harvey data, all we're doing here is switching out what our outcome variable is here. So rather than predicting mental health as a function of your home damage and differences across social capital, we're then just going to model whether or not there are differences in receiving post-disaster assistance as a function of experiencing home damage and the social capital in your community. So here are some of our empirical results. These chloropleth maps describe the spatial distribution across Houston's 150 zip codes and our two measures of social capital. Among Houston zip codes, the average volunteering rate on the right was 5%. So in the average Houston zip code, 5% of the Facebook users are involved in a volunteer organization. It ranges from around 1% to nearly 13%. Whereas the mean level of connectedness on the left was 37%, meaning that in the average Houston zip code, 30% of Facebook users are connected in some way with someone who the Opportunity Insights group have estimated are not in their class group. So if they're on the top, not tercile, top quartile of the estimated income distribution versus the bottom quartile of the income distribution. That ranged from 20% to 59%. Although note for particularly astute audience members, I've actually mapped 2 times the connectedness rate, although if you just divide that by 2, then that would be what I just told you out loud. I will fix that for the next time I give this talk. This table is showing you a selection of the descriptive statistics for the samples. The first column is the mean and standard deviations, or the proportions among the pre-Harvey sample, the 2,508 folks who were interviewed in the summer before the disaster. The second 2 columns correspond to the descriptive statistics for the post-Harvey sample, broken down by home damage and weighted by the inverse probability of treatment. The first 2 rows show our mental health measures of interest. So before Hurricane Harvey, on average, 6.23% of the population had psychological distress, and 13.7% had poor mental health days. There was no difference among the pre-Harvey sample and those without home damage after Harvey, but among those with home damage, rates of distress were 15.22% and 31.79% for poor mental health. Among the set of demographic characteristics, including race, sex, education, income, other characteristics that we expect to potentially confound the relationship. The weighting scheme resulted in balance across both those who experienced home damage and who did not, as well as balance comparing to the pre-Harvey sample. So for example, in every single one of the samples, around 35 to 36% are white. The second largest group in Houston, actually nearly the largest racial ethnic group in Houston is Hispanic, is 37%, et cetera. You can compare across to see that they're observably similar on these sets of characteristics. So here I'm showing you for the multivariable results, the regression coefficients and 95% confidence intervals from that first equation I outlined for you. The first column are the coefficient plots for before Hurricane Harvey, and the second column presents the plots for the post-Harvey sample. So before Hurricane Harvey, there were no statistically significant associations between local rates of volunteering and connectedness and either psychological distress or poor mental health days. Either in an unadjusted model, so just a baseline correlation, or the adjusted model is the regression equation that I showed you that adjusts for vector x, vector z, and the urban region fixed effects. After Hurricane Harvey, residing in a community with greater connectedness and residing in a community with greater rates of volunteering were both associated with a lower probability of distress in the unadjusted models, but after adjusting from observable characteristics, the confidence intervals overlap 0, so we cannot reject the null that there's no differences. But again, these are average differences across communities before and after Hurricane Harvey in the relationship between local social capital and 2 mental health outcomes. However, the effect of home damage on mental health varied. I first wanted to estimate for us from regression equation 2, using the inverse probability of treatment weights, the association between experiencing home damage and the probability of distress and poor mental health. Unsurprising to anyone, there's strong and statistically significant association, even after adjusting for differences in selection into home damage, controls for observable characteristics of the individual, controls for observable characteristics in their zip code and their urban region fixed effect, such that experiencing home damage increased the probability of distress by 9.4 percentage points and increased the probability of experiencing poor mental health by 18.1 percentage points. However, the effect of home damage on mental health varied significantly along local measures of social capital. So here I'm plotting the results from the third empirical model, the interaction between home damage and local social capital on psychological distress in the first panel and poor mental health in the second panel. The first column is across the z-score for economic connectedness, and the second column is across, the distribution of rates of volunteering or civic engagement. The probabilities are displayed for those with home damage in purple and those without home damage in the green color. From the first row, we see that among those with home damage living in a community with higher rates of volunteering and greater levels of connectedness was associated with a lower probability of psychological distress relative to folks who experienced home damage but lived in a neighborhood with lower levels of social capital. So for example, holding all other variables at their sample means, respondents with home damage living in a community where the rate of volunteering was 11% had a predicted probability of psychological distress of 7%, compared to observably similar people who also experienced home damage, but they lived in a community where the volunteering rate was 1%. Their predicted probability was triple that at 21%. So there was no difference in the probabilities of mental health outcomes across local social capital for those who did not experience home damage, as evidenced by the straight lines in the green across every single measure. In fact, the adjusted probabilities of mental health problems for residents of neighborhoods with high social capital, so I'm defining that as above around 1.5 standard deviations, the sample mean, the difference in the probabilities between those with and without home damage were not statistically different from 0. So there was no statistically observable difference in the probability of our mental health outcomes across levels of home damage if you lived in a community with high levels of social capital, as defined by above 1.5 standard deviations above the mean. Finally, we examined if local social capital similarly stratified the receipt of post-disaster assistance, again, given that theoretical expectation that social capital promotes the sharing of resources in times of need and may allow for folks to reach out to their network, to their friends, their neighbors, their local civic groups, their churches in order to receive aid. And indeed, we find that for those with home damage, higher levels of social capital were associated with a greater probability of receiving assistance, adjusting for all of our characteristics, and balancing on selection into neighborhoods and selection into damage. Each one standard deviation increase in volunteering on the right was associated with a 6.9 percentage point increase in the probability of assistance, while the per standard deviation association for connectedness was around 5.4 percentage points for those with home damage. However, unlike in the other graph, we also find that for those who did not experience home damage, greater levels of social capital were negatively associated with the probability of assistance receipt, such that for communities in low levels of social capital, there was statistically indistinguishable probabilities of receiving assistance across home damage. So how do we make sense of these findings? Put simply in 3 sentences, I'm doing great on time. We showed that before Hurricane Harvey, there was no association between local social capital and residents' mental health. After Hurricane Harvey, community-level social capital offset the adverse mental health consequences of disaster-related home damage, a core cause of mental health for acute disasters that affect the built environment. We found that local social capital also promoted greater assistance receipt in parallel with theoretical expectations around the use of social capital among those with damage, and more broadly, forms of local social capital meant that receiving disaster assistance occurred in a generally more efficient way, I think an economist would call, insofar as we believe that those with home damage were more in need of receiving assistance versus those who did not have home damage. So there are a plethora of limitations to this research design. This was our attempt to use some statistical techniques in the absence of extremely costly longitudinal studies where we follow individuals over time. How can we take 2 cross-sections of a representative survey that occurred right before a disaster and right after, and how can we try and untangle some of these selection processes to produce estimates that we argue are generally less biased and potentially more efficient? There are several limitations to this. The first is that our findings may be complicated by seasonal trends in health that vary across levels of social capital. So recall the pre-Harvey survey began in May 2017 and ended 5 days before landfall in August 2017. It resumed in late January 2018 and ended in April 2018. That means there's no overlap in the calendar month of year that could tell us whether or not it just happens that in the summer social capital mattered more for people's health or didn't matter as much as it did come February, March, and April. And so we're unable to test the fact that our results could be biased by seasonal variation in the relationship between social capital and health. To my Google Scholar search, I have not found a study that's looked at seasonal variation in the association, so if anyone has something, please send it my way. Especially if it suggests that we're understating the effects. Just kidding, just kidding. Tell me if it also suggests we're overstating effects. Second is that we restrict the study as a function of the sampling frame of the Health of Houston survey to only people who are residing in the Houston metropolitan area. So that means that our post-disaster sample will systematically miss anyone who migrated from Houston outside of the Houston area. Recall that we do know if they stayed within Houston but just moved to a different zip code, we assign them to the zip code that they were living at during Hurricane Harvey. But if you moved out of the city as a whole as a function of Harvey, we would be missing you. The potential for bias for our results is quite complicated. So in general, past research finds that people who are displaced after a disaster tend to have worse health outcomes. So to the extent that we're only interested in the effect of disaster damage on health, that suggests that our estimates are understating stating the true effect if we're missing all of those people who left. However, the extent to which your probability of the correlation between your probability of leaving Houston and your health, if that varies across levels of social capital, so you might imagine a context in which living in a high social capital community, even if you had bad health, would give you resources to let you stay versus entirely move out of the city, versus if you were in a different type of neighborhood. So that would complicate the picture to the extent that we can assess whether or not we're overstating the differences across social capital or understating them. And again, I've yet to see research that suggests either direction of the bias, and my co-author and I are trying to think through that a little bit more. In particular, now I'm rambling because I feel like I have one more minute. Our next step is to exploit or to leverage some of the 300 respondents who did move after Hurricane Harvey, and see if there are differences in their new neighborhood versus their old neighborhood and how we might. But again, that would only be if you stayed within Hurricane Harvey. More broadly, I think this research, besides some of the empirical contributions, calls into question how we understand average differences in community, the benefits of community social capital versus for those who might, in theory, be particularly in need of leveraging their social networks for getting resources in the post-disaster context. And it calls into question the way that after climate-related disasters like Hurricane Harvey, how the social infrastructure, the social fabric of communities can stratify health and well-being in the long run for communities across North America. So I will end it there. Please feel free to reach out, but I'll also be here for another hour. So thank you for listening, thanks for coming, and I'm happy to answer questions. Hi.
Thank you so much. I found this really fascinating. Well done. Your figures are so compelling and interesting, this relationship between the social capital measures and then sort of mental health outcomes. But I'm wondering, I'm so curious about whether you think those social capital variables are sort of causal to a degree, or I'm curious about the degree, for example, to which they might be covariates of the factors in those X and Z variables that in your regression, like income. Yeah, I'd love to know a little bit more about the degree to which you think social capital might be a covariate of other factors.
Yeah.
Is it kind of an emergent thing, or is it the variable, is it the explanatory variable itself? I just love to know why.
Yeah, great question. So in an ideal and entirely research unethical way, we would randomly distribute a bunch of people into neighborhoods and then vary their social capital and see what happens. That would allow us to estimate the causal effect. A strategy that we're thinking about taking that may additionally get at that would be to, so what I showed you right now are the average effects. So our whole shtick as it currently stands is how can we use some of these tools to better estimate average associations. But recall that the economic connectedness variable could, in theory, really matter for low-income people who experience home damage, because it's the extent to which people of different types of social class have friendship with folks in their different class. So it's been theorized to particularly matter for low-income people. So another way to do this would to restrict the sample just to people below some income threshold, and then test, do we still see similar differences for the economic connectedness variable, given like the stronger theoretical expectation that it matters for them more than a high-income person who happens to have lots of friends who are low-income, or a neighborhood where lots of high-income people are embedded in networks with low-income people. We may not expect for that to matter for them as much. So that might be a theoretical reason to try and get more as like, is it doing the causal work for us? The urban region fixed effect is trying to get at the broader processes that sort some people into certain areas in Houston. So you could easily be like, I don't know if that's really doing the thing that you're saying that it's doing. It's hard for me to imagine. When I moved to Houston, I lived in Houston for a year. I certainly had like an area that I knew I wanted to live in. I don't know if I picked the neighborhood necessarily particularly for some of the features, but I knew like the general region that I was interested in. And so that was the motivation behind trying to include that. But yeah, I absolutely appreciate the question. Mm-hmm.
Thank you so much for your talk.
Thanks for coming.
Yeah, I was just wondering, like, what kind of implications do you think this study has, like, if it would be replicable, like, in other communities for, like, urban planning and, like, public health contexts? If, like, yeah, like, what do you think, like, what do you kind of hope, like, this kind of information will provide?
Mm-hmm. I should have given this question more thought given the audience that I was coming to today. So several things. I think for, I don't know if there are any economists in the room, but I think it suggests that in like estimating the cost benefit of investing in certain types of like volunteer organizations, like the clear benefits to reducing potential burdens on the mental health care system are very clear. So I certainly don't expect that many economists when they're pricing out like how much is it actually worth to build a new volunteer center or to for public officials to give $2,000 grants to organizing groups, that they think that, well, actually there may be benefits to that investment after a disaster happens because it may promote mental health well-being, and then those folks aren't going to go to the ER or they're not going to have health consequences. So that's one way that we might particularly want public officials to think about investments into like civic groups and broader events that may foster connectedness among individuals and communities. For urban planners, I think similarly thinking about the spatial dimensions of where like high social capital places are can be used to understand what places might most benefit from reforms in the urban environment. I mean, Houston is a pretty urban place. It's very sprawling, although. And so that might give us some more interest in understanding where might it be particularly effective in a neighborhood to invest in spaces that would promote connectedness across people. So that's what I would generally say. Yeah. Should I keep this on for Q&A?
Could you?
Yes.
Thanks.
You're welcome, YouTube. Yeah.
Fabulous talk, super, super interesting. I have some like similar work in a qualitative
Oh,
sense
sweet.
that I'd love to talk to you about later.
Yes, please.
But I was wondering, I feel like social capital, as you talked about, is such a loaded term, and I had actually not heard about the Opportunity Insights data set, and it sounds really, really interesting. And so my question is kind of like, one, what did you like about that data set, or and kind of, you know, what do you think some of the strengths were? I mean, obviously it seems like a really interesting proxy, and then on the flip side of that, like if you could collect your like dream data on social capital, like what would that be? Like sometimes I think of these and I'm like, ooh, like is that a measure of social capital? Like I don't know, maybe there's so many things that you could collect.
Yeah, great questions. Tremendous questions, actually. So I think the benefits of the Opportunity Atlas, as described by the folks who developed it, are that by increasing the number, like the bigger the data, the more reliable the estimates are. So anytime we're estimating like small area averages of social capital, the larger the sample, the more reliable and valid the estimates will be. More reliable across places and more, well, I don't know if they're more valid, but in any case, more reliable. Whereas if we were to take these 5,000 folks, ask them about their engagement in, unfortunately, there is no question about whether or not they're engaged in a volunteer organization, because then we could do a little check against what Opportunity Atlas says and what our sample says and see how much they're correlated with one another. And so we were particularly motivated, one, because we haven't seen a disaster paper use the data. They've primarily been used around economic outcomes, some health outcomes as well. So this is an interesting context. And then just by estimating more reliably, although of course Facebook data come with their own issues around who's on Facebook, although it maybe is a more democratic like more people use Facebook from certain groups than we might expect from other sources. And then what's my ideal measure? Oh, one more comment on the first question. So the first way, actually, when we first were looking at differences across local social capital and the assistance receipt, was kind of like a gut check. Like, are these local measures of social capital really differentiating people in the extent to which they are like using their social networks? So we originally had framed this graph, in particular the purple interaction term, as like we're actually picking up something. We do think that the Opportunity Insights data are actually picking up something related to social capital. My ideal measure of social capital would similarly rely on some of the strengths from Opportunity Insights that are large scale in nature, so we can reliably estimate at a small area what they are. I think trust is a really important aspect, generalized trust, the extent to which you think your neighbors can be trusted, or if you can't be too careful in dealing with people, is the question often used in surveys. If we had that for all 390 million Americans, that would be great. So trust was not necessarily included in here, which is something that I'm increasingly interested in. Other scholars have used, as I mentioned in the front end of the paper, local, like the concentration of organizations that are theoretically linked to social capital, like church density of churches or other religious groups, the density of recreation facilities. Back in the day when Putnam first wrote Bowling Alone, the rates of like bowling alleys, et cetera. And so that is also something interesting, although when we get to a zip code level, it's a little bit more difficult because those are so strongly correlated with other characteristics. So, yeah. Thanks. Yes?
Yeah, thank you so much. And Polly, such a great question. I have maybe a follow-up
Yeah.
on that a little bit about the data itself, or this connectedness, which is, do you feel, or are you, when you're talking about connectedness, is this, the local folks that you would be connected to on Facebook, like the friends that I've met here in Vancouver versus my friends from high school and who knows where, right?
Mm-hmm.
And whether or not, if that's the case or if it's not, but, is your sort of global connectedness also a factor in your ability to maintain mental health after a disaster, as opposed to just like your local connectedness?
Yeah.
Can you tell that difference, or? Yeah.
Great question. So yes, so Opportunity Atlas Group folks created two indicators of this connectedness variable. One just focuses on the networks within a zip code, and the other one is estimated for the average person in a zip code, their network, irrespective of where that network is. And so what I'm showing you here are the within zip code estimates. Unfortunately, there's not a lot of difference. They're highly, I don't know, that's not unfortunate. Statistically unfortunate, but in general, I think that's probably a good thing. They're highly correlated with one another. So, yeah, so basically if we use the other variable as well as a robustness check, and the effects maybe differ by like 0.1 percentage point. So they're highly similar. So there might be another way to get at that. The Opportunity Atlas data, the friendship, the 21 billion network say nothing about like the length of the friendship. Like I'm friends with some people on Facebook who I would absolutely not refer to as someone I would rely on for, and I'm sure we all have something similar. So it's a proxy, but it would be ideal, again, getting back to the ideal, if we had a sense of like how often these networks are interacted with on, like how often do I like this person's stuff, or do we message on Messenger, or how long have we been friends, stuff like that. That's not included in their analysis. Yeah. Yes.
Thank you very much. I have a question that builds on Manny's question, and it's, so it sounds like you can't quite at the Opportunities Atlas level distinguish between different, say, advantages of connectedness, different types of help that you might get. So I'm asking you to pontificate a obviously there's advantage related to kind of a friendship where you're gaining resilience and kind of capacity to continue to function post-disaster. And that allows you, as you're functioning, it allows you to kind of remain on top of opportunities that come up or grants or whatever. So that's kind of a mental support area. It could be that there's assistance in reaching contacts. You know, that the more connected you are, again, you have more people and you're aware of who can help with what, and there's potentially connection that actually allows you to pool resources and finances and all. So what do you think? Like do you have a sense of how social capital kind of comes into play and how it helps people
Yeah, mechanisms. Great question. So I think from my perspective, especially in conducting analyses that are secondary data analyses, so I was not involved with the collection of the HHS data. My perception is that qualitative interviews are best suited to address some of those questions. So Max Besbris and Anna Rhodes wrote what I think is a pretty good book on Hurricane Harvey and recovery, which included long-term health outcomes. I just wrote a book review for Social Forces for this book, and now I can't remember what it's called. But in any case, Besbris and Rhodes and Besbris, pardon me, and they focus on social capital in one chapter, in which their focus was on middle-class communities. So not low-income people in Houston, not high-income people, but those who were middle class in a southeast part of the place called Friendswood. And they found that in the immediate aftermath, the collectivizing of resources really mattered a lot for people's immediate post-disaster well-being. So certainly not 5 months later but not to say that what happens in the immediate aftermath can't shape what happens later, but a little bit of a different context. But so they showed that the ability to pool resources, the ability to call on one's neighbor in Friendswood in order to so some folks in their in-depth interviews were stuck at a school because their home had flooded, they had to get out, and they had no way to get anywhere, and so they were able to call someone. And so that was a way in which, especially when the government officials weren't responding immediately to the neighborhood, that they used some of their ability to connect with each other in a way that promoted immediate post-disaster well-being. But I think you're kind of getting at another point, which is the focus of the paper is all about sort of post-disaster, social capital shaping post-disaster mental health. We were doing some stuff to see whether or not there was some selection mechanisms, but social capital can also shape preparation mechanisms, in the week leading up before the disaster actually happened, when the National Weather Service had declared that Harvey wasn't going to occur. Social capital certainly could have meant that people were prepared better. That's excluded, promoting broader, more resilient communities, even if it doesn't necessarily shape health per se, are all questions that for someone who's spending a career addressing that first research question, or a graduate student writing a dissertation that's going to try and address that question, those would absolutely be things that I would want to know. Thanks.
Thank you.
I think, oh yeah, Rose.
Hi, I have a question which is probably not included in your analysis. I wonder if gender plays any influence on the correlations between connectedness, social capital, and your health. According to the relational theory, we have women are more likely to reach out for help, but men for their masculinity, they probably just keep it to themselves.
Yeah.
So I wonder if you notice any gender difference between those correlations between social capital and your mental health.
Yeah, good question, Rose. And Rose provided excellent research assistant. She's one of my graduate students. So we haven't looked explicitly at gender differences in the effect. We certainly could. I think there's probably enough difference. So there's around 600 folks, so around 310 who were women. I would also want to combine that, since like home damage, especially for married people, is like a household level experience. We might want to look at men, like single, never married. That's NM is never married. Differences at both the intersection of marital status and gender, to really try and get at that difference. Because we can imagine a scenario in which it's the man responding to the Health of Houston survey, but like his wife did a lot of the stuff. But if we compared like single, never married men to probably any woman, then we might be able to get at that a little bit better. So yeah, I think, well, we haven't looked at it, so I don't know if there are any differences, but it's an interesting question. And race we haven't looked at yet either, but absolutely something that we could think about looking at Hispanic versus other racial groups, or Black or Asian, but the numbers are smaller. Did I miss someone? Yes.
Do you have information on tenure? So how long they lived in?
Yes, also great question. I didn't think we did, but we do. And so as we revise the paper before we submit it, that is on the docket to include in Vector X. Thank you. Yeah, it's coded as the number of years they've resided in the neighborhood, which could also be another avenue to, on the one hand, we might want to exclude entirely anyone who reported that they resided in the neighborhood for less than a year. And then we also might want to include I would probably consider including a quadratic term for the amount of years that you've lived in the neighborhood. Yeah, rather than a linear term, because on the one hand, we might imagine that like right when you move into a new neighborhood, you're exploring like lots of the ways that some of the social infrastructure may matter to you, whereas if you've been there for a very long time, maybe you are a little bit, like you don't really do too much. So, but yes, thank you so much for asking. I should have mentioned that as well. I'm trying to think if I'm forgetting something else that what's on the docket. Besides looking at the 300 folks who moved within Houston before and after Harvey, conditioning on the amount of time in the neighborhood. I feel like there's one other that I'm forgetting that I'll remember late at night. Yes, Stephanie.
Thanks, it was just really fascinating and appreciate all the care you took into all the analysis. I was wondering, just a very quick clarification question first, and then
Yeah.
a more substantive question. The pre and post sampling, were they in the same neighborhoods?
Yes. Yeah. Yeah.
It just,
So there's at least 2 in all 150 zip codes, but on average it's around 40 folks per zip code. Does that make sense?
so the same zip code, some people would have been sampled before and some people would have been sampled after?
Yes. So yeah, we're not following folks over time. Yep. Yeah. A few thousand people before, a few thousand people after. Yeah.
Can I ask you about the assistance dependent variable?
Yeah.
It sounded, if I heard you right, it sounded like it was a 1 or 0.
Yep.
And it was a 1 if they received any form of assistance, whether it's from the church or from an official source or from whatever it might be.
Yes.
I wonder if you think that, or if you've investigated whether there might be a difference in terms of people's propensity to receive different kinds of assistance.
Mm-hmm.
Yeah.
Yeah, great question. Thanks, Stephanie. So we included, oh, I said it out loud. I didn't include it in the slide. Sorry. Thank you for listening. Yeah, so we dummied down the variable for the purposes of the first draft of the manuscript, although it was constructed from a series of 6 questions, actually 12. 6 questions. No, sorry, 7 questions. 6 questions. The first 6 were, did you receive help from after Harvey? Did you receive any assistance? If yes, then from whom? And then there was a series. It was friends, families, neighbors, civic groups, government, and then maybe like other. And we originally just decided to focus on if you said yes to receiving assistance from your neighbors, because that was like our primary process. And the results are similar, but the confidence intervals are bigger because it's a smaller subset of folks. And we also condition on receiving assistance from those other groups. And then the question that we haven't included yet was that there was a series of questions that was also asked whether or not you gave out assistance. Did you provide assistance to anyone else? That didn't ask who you gave assistance to. It was just, did you provide assistance to anyone else after Hurricane Harvey? And so we originally constructed a mutually exclusive 4-category variable, whether or not you both received and gave assistance, you received and not give, you gave and did not receive, or you did not have either. And it was just really confusing to interpret the differences across neighborhood social capital. But I think it potentially, one could be the did you give assistance could be a control variable. A lot more people in the neighborhood say that they gave assistance than folks who report that they received assistance. So obviously they're not one-to-one comparisons, because ideally we would want to know, like, within a zip code, the average people who said they gave assistance to someone in their zip code, and the average person in that zip code who said they received assistance from someone else's zip code. Any difference between those two responses would suggest that something's not right. And so those are ways that we might be able to get at some of these processes a little bit better by focusing on the different sources of assistance, maybe excluding like those from government, as well as also rethinking through giving versus receiving. There's something about reciprocity, or something about doing both that may be patterned. So I might think through that more. Yeah.
Hi, Ethan. I'm Nora. Thank you
Hi, Nora.
so much for the presentation. My first question actually is related to the one asked earlier.
Yeah.
Considering there's a whole lot of literature on the gender of social
Right.
capital.
Yeah.
And so I won't ask that question anymore. I think the second one, I was struck with one of your findings, that there was no connection between social capital and mental health before the disaster.
Yeah.
Am I correct?
Yes.
And so it led me to my question regarding how you define and operationalize mental health to begin with, and whether you distinguish between different sources and types and manifestations of mental health with regards to, because a traumatic experience like a major disaster and loss of home could be in itself a source of mental health concerns. Did you distinguish between more neurological, relation deficit, clinical? How was it, I guess, defined, or did you look at the whole range of spectrum depending on how people were self-reporting on mental health?
Yeah, great questions. I'll answer the latter first, if you don't mind. So, yeah, we were constrained by the questions that this public health survey administers. So there are only 2 on mental health. Much to my and my co-author's chagrin, which much would have preferred in a post-disaster context to have something around post-traumatic stress symptoms or post-traumatic stress disorder. The sequelae between disaster exposure and PTSS, post-traumatic stress symptoms indicative of PTSD, is extremely strong, and we would suggest that rather than these 2 measures of mental health, which are cause agnostic, so they're not specifically around the psychological distress, doesn't ask, did Hurricane Harvey lead you to have experiences of restlessness or depression? And so we are constrained just by these 2 variables, which means that we're missing the whole range of both event-specific mental health problems and other types of, one, clinically diagnosed rates. They ask, like, have you ever been diagnosed with cardiovascular disease? But they did not ask, have you ever been diagnosed with a mental health disorder? Which I think says a little bit about the way that we treat mental health versus physical health problems. But these are sort of what we have to work with. And so I think it will require in the final paper a paragraph thinking through how much can we learn about social capital and post-disaster mental health when we just use these 2 variables. What are we missing out on? And so we'll think through that more rigorously. Gender dimensions, yeah, again, not something we've explored yet, but I think with the infrastructure set up for the models, it's absolutely something we can consider doing. The treatment weighting scheme will maybe require some changes, but I'm glad to know that potentially my graduate student is interested in writing a paper on the gender differences. So thank you. Thanks for those questions. Yes?
Hi, thanks for the talk. I'm trying to think through a bit the role of like a community development organization type of civic group that the volunteering variable like maybe captures, but also maybe not, right? Like because a lot of these organizations claim in their purpose to work in these groups, in these neighborhoods that maybe have low social capital and try to meet some of those effects, try to
Yeah.
So the question I was wondering is if you did have the data on like the presence of civic organizations in these neighborhoods, do you think it would intensify the relationships that these personal networks are showing, or mediate relationships in some way? Like, which role do you think these kind of organizational infrastructures would play? And I know the volunteering variable kind of gets us there, but I'm wondering if you think it gets us all the way there, or if you think there's another dimension to the role of organizations here.
Yeah, great question. I would see that as, I would understand it in the 10 seconds that I'm thinking about it as a mediating variable. So I would expect if we were to estimate these equations and condition on the organizational infrastructure in a community or these types of variables, that's like one pathway through which these broader forms of a public good are going to have downstream effects on individuals' mental health. In a similar way that if we were to condition on the individual respondents' level of connectedness to their neighbors, how many friends in their neighborhood they have or something like that, I would expect for that to explain the associations we're detecting here. Similarly to the organizational infrastructure, I would expect that to explain rather than be like a three-way interaction altering the relationship between social capital and health for those with home damage at various levels of organizational process or organizational infrastructure. But I would have to think through that a little bit more. We originally tested, my co-author Kevin has a paper on local organizations, and as a measure of social capital, and I don't know if it's health or if it's post-disaster mobility. But it's a study that's done at the US county level, so like the census subdivision level in Canada. And so it's very large. And so we're thinking about that's not a neighborhood. Counties are not neighborhoods. Some argue even that zip codes aren't neighborhoods, but for the purposes of today's talk, I'm using them to operationalize one residential environment in which we might think these processes operate. It's just hard with the data that are collected right now on estimating zip code level rates of these groups. So
Especially these kinds of groups that don't necessarily
operate within.
It's not a church or a
Yeah, exactly. Yeah. Andrew.
So I know you've written about more than just Hurricane Harvey, different disasters, different contexts, different types of health outcomes. And I'm interested in maybe zooming out a little bit to situate social capital as a buffer against the negative health impacts of disasters in the landscape of other potential buffers that planners might have agency or influence over, thinking about how we can do our utmost to protect deepening health inequities as a result of disasters. So where does social capital sit in relation to other, whether it's forms of capital, other resources, other types of relationships, in both protecting individuals and communities' health, but also protecting against widening health inequities? And what strategies, we can address social capital directly, or we can address social capital in tandem with other things, and are there other pieces of the pie that you think planners really need to account for in addition to social capital to protect health equity in the wake of disasters?
Yeah, great question. So this is one of the, I wouldn't say few, but increasing number of my research stream that is really estimating the average effects rather than differences across social groups, which help us get at disparities. And so I think that social capital, not based on the empirical evidence I presented today, but based on my reading of the literature and my own stance as a scholar, can absolutely fit in with planning around like the core constitutive parts of like disaster resilience and disaster awareness. So like another article that I have with these data are looking at differences in the health consequences of Harvey for people who are living inside of floodplains, so that were protected that were within the zone that FEMA said you might be flooded, versus those who were living just outside of the flood zone. So that's like absolutely something that the government and that city officials in Houston had a say over drawing where those maps were. And the headline finding is that the health consequences of flooding is worse if you lived outside of the flood zone. And so I think like awareness and using forms of social capital to build resilient communities in the face of increasingly severe, unpredictable types of extreme weather-related disasters is one way that like we might consider integrating it. So like incorporating when the local government draws flood maps, like relying on forms of social infrastructure in the community, like civic groups, like local networks, in order to expand awareness around some of these like planned processes, would certainly be a way to like, I think, bolster some of the work that planners are doing. So that's sort of one of my big thoughts in this broader project on Harvey that I'm doing. Yes?
One piece that you mentioned, it sort of builds on Andrew's question, but sort of extending this. I was really interested in this idea of looking at people who left Houston.
Mm-hmm.
I'm not sure how deep whether you have some suppositions about this or you already have maybe some data on it, but I'm really intrigued also by the connection of that pattern of leaving the city and that dark side of social capital.
Yeah.
You mentioned it. I've seen some other studies, did a bit of work in Tanzania where people with low social capital left, partially because they thought, I don't have the resources to manage this, so I'm basically out of here. And people who felt that they had more resources stayed. But I guess depending on the severity of the disaster, that could be a prudent or deeply imprudent decision. So I'm sort of wondering here, if you know who did leave, and where do you think they fell in terms of their social capital, and how do you think, do you have suppositions about how that may have been a prudent or imprudent strategy?
Yeah, great question. So the evidence on like health selection into post-disaster displacement largely comes from the case of Hurricane Katrina. And so there's a debate to be had about the extent to which we can generalize from that disaster to Hurricane Harvey. So we have looked at the zip code level, the population change from the American Community Survey in like 2016, like the 5 years estimates then, to the most recent one that just came out, which is 2018, 19, 2021. Yeah, 2018 to 2022. I know we're both well acquainted. And look, just conditioned on the percent change in population at the zip code level from then. That doesn't tell us anything about the reason behind the change in population, but Hurricane Harvey might be one like particular matter. What I'm sort of struggling with is might expect for someone who lives in a low social capital community who's badly affected by the disaster, that would cause them to be more likely to move within the city. Like someone who's in a low social capital community, particularly maybe if they're low income, I think that most people tend to stay in the city. Like getting up and moving to an entire new city is a big deal. And so I guess I just don't know, and I can't even remember if the census has published like the estimates around how many people left from the month before Harvey to after, or long run, because a month could just be you're out staying with your family in Baton Rouge, and then you're going to go back to Houston after things settle. And so it's unclear like the number of displaced people. If it was like 50,000, if it was 10,000, if it was like, hundreds of thousands, which I don't think it was. So those are all things that we could look at. One way of empirically interrogating what I just outlined for you would be to look at those 300 folks within our sample who did report different zip codes and see whether or not they tended to be from lower social capital places.
Boy, if you run those numbers, I'm really intrigued.
Okay, yeah. I'll email you. Yes.
We have time for one more question.
Okay.
Maybe,
Yes, please. Yeah.
Well, thank you. That was so much interesting ground here. And it's just very tempting to want to go beyond where you thought and maybe where you want to go. But I find myself curious about the relationship that might be discovered between neighborhoods, communities with a level of social capital and the amount of public investment in that community and the neighborhood in amenities that support the development of social capital,
Yeah.
in the location of government public agencies that serve communities that may have a higher need for some reason, for whatever reason, because that, you're looking at informal
Yeah.
networks of social capital, but this institutional infrastructure may be really significant in how much social capital develops. And I think in particular, for example, of what happened in the downtown east side during the pandemic,
Yeah.
and how I don't know that that's been studied academically, but what potentially could have been an absolute disaster situation because of the density of institutions and community institutions, nonprofits, government agencies, and a very high degree of social capital. It was arguably not the disaster that it might be, and because it was proactive activity. So I'm just really
Yeah.
interested in your thoughts on that.
Yeah, I appreciate that question very much, around the role that like formal institutions related to building social capital would play in this story. As you were talking, I kind of like switched from my original answer, was that I'm not exactly convinced that now, I've changed my mind. I reserve the right to change my mind at 2:15. That I don't understand necessarily as something that would mediate some of these relationships, that might be its own independent factor. And what you outlined suggests to me that like the attention to what's going on even like before the disaster occurs with the infrastructure that's there and like the history in the neighborhood certainly matters. And so, empirically getting at that might be around like changes in the number of civic groups that are reported in the zip code, or a big one is just like change in sheer population. So some neighborhoods in Houston have experienced since 2010 a large increase in their population. Other neighborhoods are experiencing declines in their population. That comes with related issues of social capital in neighborhoods that are declining. So that might be something we look at. And I will say that the majority of work that I cited in some of the first slides in disaster scholarship in social capital are getting at these, or are trying to get at these institutional forms. So the number of organizations, the nature of the organizations in the area. And so I guess maybe a little bit to sociology is to pivot us away from those questions and more towards the informal social fabric of the community. But I absolutely appreciate that in discussion of the latter, mentioning or integrating the former, the institutions play an absolute key role for supporting the extent to which those informal networks can actually thrive. So yeah, I'll have to think about where that comes in the final iteration of the paper.